Hello and welcome. We are pleased that you've joined us for today's session, Healthcare Organizations Reduce Cybersecurity Threats. Before we get started, I want to share our big news that Moss Adams and Baker Tilly have joined forces to redefine accounting, tax, and advisory services for the middle market. It's really exciting, and you can read more about that on our website through the link in your console. And now I'm going to play our housekeeping video.
Welcome and thanks for joining us. Our webcasts are designed to help elevate your business performance. Transform your future for the better with advisory solutions tailored to your vision and supported by our collective technical resources. Our presentation will start in a few moments. Before we begin, here are a few things to keep in mind. You can customize how you both view our presentation and interact with the presenter. For better viewing, close all other applications and turn up your speaker volume. You can also adjust window size and placement or enter full screen mode using the controls at the top of the window or dragging the bottom right-hand corner to resize. At the bottom of your screen, you'll see a series of icons, each relating to a different aspect of our session. You can download the group attendance sheet and a PDF copy of today's slides from the slide deck and handouts widget. You can ask our presenter questions during the webcast by typing a question in the Q&A window and clicking Submit. We'll do our best to answer all questions during the presentation or follow up via email. If you experience technical difficulty during today's presentation, refresh your browser by hitting the F5 key. Today's session will offer you 1 CPE credit. To receive credit, you must meet the requirements as specified by the National Association of State Boards of Accountancy. You must attend at least 50 minutes of the session and respond to at least 75% or 3 of the 4 polling questions, which we'll ask throughout today's presentation. Polling questions will appear within the slide window. To participate in the polls, please click on your answer and be sure to hit the Submit button to record your response. We'll track your progress and alert you when you've earned CPE credit. You can then click the certificate icon in the CPE Progress widget and download your CPE certificate. Don't worry, if you can't download your CPE certificate today, we'll email a copy to you in 2 weeks. If you're attending this webcast in a group, you must complete our group CPE attendance sheet to receive credit. The attendance sheet is available in our slide deck and handouts widget. Please have all group members sign it and send only 1 sheet per group. Also note that CPE credit only can be awarded to participants registered as themselves, and isn't available for participants who view the on-demand version. As a reminder, the presentation you're about to see is not legal, investment, or accounting advice. We encourage you to seek the counsel of a professional service provider to apply this content to your specific circumstances.
All right. In addition to the CPE that's being offered for today's webcast, Foley and Lardner are offering CLE credits. And to be eligible for CLE, you will need to be logged in for the full duration of this webcast and record the 5-digit course code that will be announced during the program. If you are seeking CLE credit, please complete the attorney affirmation form linked in your console with the 5-digit CLE course code, which will be announced. And now I'm going to hand it over to today's moderator, Jennifer Urban, partner at Foley and Lardner.
Hello, welcome everybody. We're so excited to talk to you today about cybersecurity issues and how they intersect, not just with the IT side, but risk management, insurance, and legal. I'm Jen Urban. I am the vice chair of our tech transactions, cyber and privacy team. And I am also the founder of the Midwest Cybersecurity Alliance. So we thank you so much, and I'll turn it over to Troy for some introductions.
Yeah, hello everyone. So thank you for joining us today. Troy Hawes, a managing director at Moss Adams, now Baker Tilly. It'll take me a while to get the Baker Tilly name under my belt here. But I lead our HIPAA security and high trust practice for the firm and do a lot of security risk assessments, cybersecurity assessments for our healthcare clients. Hannah?
Hey everyone, thanks for having us. My name is Hannah Hoeflinger. I am Senior Vice President of National Cyber Risk Ops here at Marsh McLennan agency. I have been in the cyber tech risk space for going on 11 years now. Originally from Atlanta, now out here in Southern California. And I, across the country, kind of help streamline all of our cyber risk services for our clients and prospects, and help specifically in the healthcare vertical for a lot of our clients, and anywhere from the cyber insurance, building out the program, to vulnerability assessments to help, with the underwriting piece of it. So been across the board. I've been client facing and then also an underwriter. So I do understand the risk modeling side of things as well. So happy to chat with you guys today.
Wonderful. Thank you. So we have a lot of objectives today, but I'll just start from an overall perspective. We all see data breaches, almost on a daily basis. And essentially, it's really the same play over and over again, but there's different actors. And really, the way in which you get a standing ovation versus a boo is preparation practice. And we're really going to talk about particular cyber risks and critical components of your incident response plan, especially in the healthcare industry, to make sure you're prepared. But a lot of organizations still do not realize that no one really comes to save you in the event of a cybersecurity attack. You really are your first line of defense. The FBI is wonderful. Spoke with them last week and doing another presentation with them tomorrow. They'll help you in the best way they can, but they just don't have the resources to have boots on the ground. So you really need to get your incident response plan prepared, practiced, and aligned if you have cyber insurance, so that you're ready to go in the event an incident happens. We all know that you're very sophisticated business people. We've seen all your backgrounds, but I still encourage you to ask hard questions of your organization and take responsibility for your part in the strategy to respond, because it is not just an IT function. And we're going to get into how we all kind of work together in this multidisciplinary approach. We're also going to do something very interesting today, which I don't see a lot of sessions cover, is we're really going to get into specific advice and help around what type of cyber insurance you should be thinking about and the different types of coverages. So we're very happy to have you here. And we're going to start out with doing some polling, but this is how our agenda is set up. We're going to go over the current cyber threat landscape, which it changes all the time. So these are some new, fresh stats. We're going to do a deep dive into cyber insurance. We're going to talk about cybersecurity best practices, in particular for healthcare. And then we're going to talk about cyber incident response. So just for us to get a good feel about what types of entities are on the phone, we are going to do a poll. And so please respond to what entity type do you represent? Provider clinic, hospital, skilled nursing facility or long-term care, tribal health, ancillary providers, digital health, or pharmaceutical. And we'll get results shortly.
Yes, and Jennifer, I'm going to jump in real quick. This is a long list, so attendees, you may need to scroll down on your slide to hit the submit button, and that's what will track your response.
Yeah, there's two other categories if you fall there as well. Great. So it seems the majority of our attendees are in the hospital and provider clinic space. Some, skilled nursing facilities, a little tribal health, some ancillary providers, digital health, pharma, and a few others in the other category. Thank you so much for doing that polling, and we will have additional polling as well as we go throughout. Turning over to you, Troy. Before we get started here, I think it would just be interesting, because we all talk about AI all the time in every presentation now, but how has AI made healthcare sector entities potentially more vulnerable to cyber criminals?
Yeah, so it is a great question, and it kind of leads into details that we're seeing on here. But AI has made cyber criminals just quicker, faster at what they're able to do, and the sophistication now behind their phishing emails, the deep fake calls, they're able to really find more ways to really find that vulnerable person or the actual vulnerability on the systems, because it also they can leverage malware quicker, faster, deploy it quicker, and then change it on the fly to actually hit a vulnerable system. And the ability of the AI that they're using is just getting more and more sophisticated.
Yeah, I just have
And
one point on that. You know, it's
yeah,
interesting you bring that up. You know, when I was out in Silicon Valley, the FBI was specifically warning about deep fakes.
hmm
And, you know, a lot of the big tech companies had experienced that directly, where their CEO and other C-suite executives mimicked very, very close
right.
to their voice and their language. So it's interesting you bring that up because that's across all industries we're seeing.
What and you mentioned that, Jennifer. There was actually an attack last year where it was a UK engineering firm that basically got tricked into sending $25 million to cyber criminals through a video call that this person had. So this person worked for the firm. He thought he was talking to senior management on this video call and got tricked into actually sending $25 million to the
Wow.
cyber criminals. So that's how crazy it's gotten with this technology. And so it's very interesting. I think kind of with that, what we're seeing with regards to these attacks and the attack types used, especially against healthcare, are all the same ones that we're seeing kind of all the time. And so they haven't changed. And so especially this slide, most of this information comes from either the Verizon data breach investigations report or the IBM Ponemon cost of a data breach report. But the attack vectors, phishing or BEC, or what's called business email compromise, those things still high attack vectors because they're usually easy. Phishing email, we're really attacking employees here. So sophistication of employees against their knowledge of cybersecurity is usually the main attack vector. And then the use of ransomware to really take down systems. And healthcare really has been a prime target for ransomware attacks. So we're really seeing that increase, as well as just third party or supplier, the supply chain and suppliers. Just recently, there actually has been an increase just even this year in the amount of third party involvement related to breaches that they're seeing. So those vectors, those risks, those are the areas that really need to get focused on when we're looking at cybersecurity. And really there was a poll done where 74% of CEOs said they were concerned about their organization's ability to mitigate a cyber attack. So thinking about all the steps that you have to go through once an attack is noticed, found, you're really going through a long process. Also through this research, the costs of breaches has increased. So 4.88, this is a global average cost of a breach, but for a healthcare related breach, just that cost is at 9.7 million. And again, these increases are the increases have gone up year over year. We've definitely seen that. And then we talked about the human element, the personnel, the insiders, really the way that these individuals can be tricked. I think that's the main thing, is they're kind of the first lines of defense when it comes to cybersecurity. And so we have to think about all of those individuals. So not just our employees, but any vendors that have access, and how are they trained against these cyber best practices. So things to really think about there. The last part of this slide, we'll actually spend a little bit more time on this, but the average number of days to identify a breach and the average number of days to contain a breach, those have gone up a little bit, but have actually slightly decreased over the last year. And we've actually got a slide on this, and we'll go into more information there here in a little bit.
Yeah, I would just say that point, these statistics are so very important, because and we're going to talk about them again later, and I think your graph will be very visually evident, is that, by the time you figure out a breach has occurred, that threat actor on average has been in your system for about 194 days, and that's just really outstanding, back to the point of, you really are your first line of defense. You're behind the 8 ball, once you discover what happens. And, we'll talk about it more when we get your slide later on, but I just think those statistics are very important.
Yes, definitely.
Right. Now we're moving over to you, Hannah.
Yeah, if you want to click through the rest of the content on this slide. So just another quick note, kind of tying this in with what Troy just went through. We are seeing, right, a lot of ransomware is still one of the biggest claims activities that we see on the cyber insurance side for our healthcare companies. And the majority of that is still happening through, right, the phishing and compromised credentials. So we do see a lot of activity in the small and mid-sized space. And a lot of that can be due to the fact that there is less IT budget, right? Like less money spent on things like employee training, and the phishing attacks and business email attacks have just gone through the roof because of the use of AI. Because the OCR's latest breach report for the past year talked about how the phishing attempts are specifically developed for healthcare professionals. So, right, they'll go out and kind of blanketly look at a lot of the, low-hanging fruit, so to speak, right, healthcare companies that might not have as much IT budget and as much bolstered security controls. So we are seeing an increase mostly in that hourly, loss for small companies specifically. Of course, the larger hospitals are still seeing, some of those larger ransomware attacks, because as we know, attackers will tailor that demand amount knowing that a company might have the budget for it.
My question, which I think is interesting, is why do smaller hospitals pay more cost than the larger hospital systems, per hour? That seems counterintuitive to me.
Yeah, so sometimes we still see, smaller hospitals not purchasing a cyber insurance policy. That could be part of it, right? So they don't get that immediate response with the insurance and the vendors that can step in and help them immediately. So it can take longer, right, when you don't have all those vendors lined up, when you don't have an incident response plan. So we do see, because some of those companies, right, they might be outsourcing a lot of their IT work. So it takes a little bit longer. So those costs go up, and not having, right, like knowing who your legal partner is that's going to get you in touch with the right forensic investigators that can come in and comb your systems and make sure everything's in place. So it does go up again because of that IT budget typically and because some of these folks are going uninsured from a cyber perspective.
Interesting. So now, Troy, I'm going to turn it back to you for your chart that's very, very helpful.
Yeah, so what we wanted to do is really kind of provide what that life cycle looks like from a breach perspective. So we've got the initial breakout. The attacker has found a way to get access, and usually that takes a couple of hours, may take half a day to a day, but they've usually done some sort of research up into that time. But once they do have access, they're pretty quick at getting access to the sensitive data, or finding out where it is, and then actually compromising that data in some way. So now they've actually got access to the data. What they're doing with it here is they may exfiltrate it, they may just sit on it for a while. And that's really where the next 194 days comes in, is now they're actually on the network, and they're not on every day, because they're not trying to get found, but they're trying to do other things. So maybe they've used some of that data for some sort of insurance fraud or other, because they're trying to make money on the side. But it takes, on average, over 194 days to actually detect that something has gone on here. And sometimes that's not the internal teams identifying the breach. It may be somebody outside of the organization identifying, hey, something's gone on with my data, or maybe they identified a credit card and tried to use it, and that started some credit card fraud, and that got discovered. And so it's basically a long time for an attacker to be on the network.
Yeah. How can organizations find this quicker? Yeah. What are some of the, how do they discover this quicker than 194 days? That's a long time.
Yeah, so the logging and monitoring tools are critical here for organizations. So being able to actually have a good tool in place, or tools, and this is where we need to leverage AI for cybersecurity as well, and leverage AI to help review what's going on the network. Because when you think about, especially in these healthcare environments, we've got a lot of systems talking, and there's a lot of network traffic, a lot of logs, a lot of data here. And so trying to sift through all of that information and really detect something that is potentially malicious is difficult. But now we've got more and better tools to really cut down that mean time to the actual detection. So that's really where I would say that's how we do this quicker, is to actually leverage the right tools.
Makes sense. And then containment, we've got another 66 days, which is a long period of time when you're dealing with, notification timelines and other things. I mean, I'll just say a few quick words. I mean, what are your notification obligations? The question and the answer is always, it depends. Likely, obviously, HIPAA is going to be in play, but state law could be in play. If you're a public company, the SEC has disclosure rules when you have to disclose 4 days from when you determine the incident is material. You also could have international laws such as GDPR with 72-hour notifications and others. If you're a vendor, you could have contractual notifications. So it really depends on where you sit in that ecosystem. But you certainly should at least have a general idea of what notification obligations come into play, because, again, it takes on average 66 days. You got to do notification requirements. And, now I want Hannah to talk a little bit about how insurance can help in that process, and also what, your team really needs to know about your cyber insurance so you're ready to go right away.
Yeah, absolutely. So I think what Troy hit on, right, is that it's really important that you do the before and the after, right? It's like pre-incident and post-incident. And what we typically discuss when we're going through the underwriting process, which is why it can be such a great tool in addition to the IT tools, is that, we're asking about endpoint detection response. And so EDR and MDR, right? Which is kind of, we even ask specifically, do you deploy AI within within those kind of detection, logging and monitoring controls? And we typically see a massive savings. So there's statistics out there, if you need a little bit of fuel to go and get more IT budget, that says your cost savings for healthcare organizations that deploy AI save on average like $850,000 per incident, which is huge. And that's where, from an insurance perspective beforehand, we're potentially saving you money on your rates too, right? So if you say, hey, we're deploying all these things that's going to reduce this time period that we're going to be sitting on this potential incident, the insurance companies are going to give you a better rate on your cyber lines, right? And then the kind of containment piece, right? What's really critical is that cyber insurance isn't just a transaction. It's not just a bucket of money. We're working with folks like Jen and Troy. We're working as soon as the incident happens, within 2 to 4 hours, everyone's in this secure little bubble where we're all discussing, okay, here's your lawyer that's going to talk through all of your obligations. Here's the forensic investigator. They're going to come in. Here's your incident response expert. And they're all going to come in and work together, hold your hand through it. And that's where those days equal money, equal dollars, right? And the quicker you get that in, the more you're going to contain the actual dollar amount lost. So it's very, very useful to make sure and are meeting with your broker and your underwriter, because they're going to connect you with all the right people when that claim does happen.
And just one other comment that was really great, Hannah. One other comment I see often with organizations is, the IT teams or legal teams or the incident response team doesn't really understand how their cyber insurance is changing, and that, especially in healthcare, might be managed by a risk manager. So making sure that the risk manager, whoever's responsible for insurance as a whole for the organization, is communicating well in advance with the IR team to understand, who is on the panel. Can we have our regular IT people, our law firms, our PR firms, call and mail centers, but getting that all arranged in advance in alignment with insurance to make sure you have your preferred providers is really the best advice. So thank you so much for that. Moving on to, we have another lovely question here. Does your organization have a sufficient cyber insurance program tailored to healthcare risks? We would love your thoughts on this polling question. I was getting worried nobody was answering that. We seem to have a few more people there. I was like, no one knows that answer. That's exactly what I was getting to. We actually, a lot of organizations we deal with that don't really know that full answer. And so I think that, should ignite new discussions. We're just waiting for our polling response back here. Yep, that's kind of what we figured. It's almost, yes, we do. Unsure, that unsure category right there is where I still see a lot of our clients, are in. Definitely those no's out there. You're in for a great surprise, because Hannah's going to actually tell you exactly what you need to know about cyber insurance and give you some concrete advice. But that is typical what we see in this space. So thank you so much for your polling. So now I'm going to turn over to Hannah. She's going to get a little bit in the weeds about how all this cyber insurance works.
Yeah, so this is, for healthcare specifically, we really do focus a lot on the regulatory environment. Healthcare was one of the first industries, period. Cyber insurance has only been around for 20 plus years, because the internet has only been around for 30 plus years. So because of the privacy laws that were developed very early on around healthcare information, we do see that this is kind of the bread and butter, the nitty gritty that we get into with them. in addition to some of the other kind of first party stuff I'll talk about in a bit. But this is why cyber insurance is a beautiful thing, is because it's one of the only lines that covers fines and penalties, right? So your general counsel like is going to be your best friend, making sure, right, you're prepared for these things. But these laws are changing so often. It's really difficult to keep up with them, and the litigation is just crazy, right? What we saw with wrongful collection, which I'll speak to here, we saw a massive influx of cyber claims from healthcare companies of all sizes. All the systemic threats that are happening, of course, Change Healthcare impacted maybe even some of the, physicians and hospitals on the call today. So I'll get into that, but here we see, I'll give a few updates. Even the new mandates that have been proposed for 2025 for HIPAA, right? Talking specifically about how MFA should be mandated, how encryption should be mandated. And these are things where it gets our clients into sticky territory where it's, okay, well, I need to make sure that this is covered on my policy. I need to make sure that this trigger is available, and I need someone to talk me through it so that I know that the value's there for what I'm paying for premium, right? So wrongful collection pixel tracking is really important. This is where we saw a lot of folks get hit because they didn't realize they had that meta like cookie on their website. We even saw some of our healthcare clients that had it on their patient portals, right? The whole, idea that my data, my healthcare data is then going to drive like marketing activity or, some sort of like data sharing activity that I didn't consent to, right? And then we had to go in and kind of advise what their privacy policies should be, how they should be changed to be compliant with the VPPA laws, right? The pixel tracking laws. So this is part of the underwriting process we go through, and then we make sure that our healthcare companies have affirmative coverage for this. The corrective action cost. So this one's really interesting. You can get an additional, and I do have a slide on this, but you can get a specific enhancement on your cyber insurance policy for that corrective action, right? So what that means is when you have, you're out of compliance with HIPAA, right? You need a CAP, corrective action plan. It's kind of an aggressive enforcement action taken by the OCR, but that's where you can get additional coverage, not only for fines and penalties, but for what you need to do to become compliant. And then there's the overlap in cyber and tech for our digital healthcare companies on the call, making sure that you have that technology, errors and omissions combined with your cyber insurance. And then, right, just more information here. Jen actually referenced this earlier, right? The SEC ruling, if you're publicly traded, that there's an even more kind of arduous reporting mandate there. So lots of updates. And again, that's why, the policy is there for peace of mind. Your brokers, underwriter partners are there to make sure that, ask all the theoretical questions, go in and be like, what if this happened, right? What about this new regulation? Make sure you're sending those questions in and that you're staying on top of it with your policy.
Hannah, I have a quick question. I've been doing that. Well, I've been practicing 25 years, but there was not cybersecurity incidents way back then. But I would say even a few years ago, a lot of the litigation, there was not a lot of litigation, right? Unless you have really big incidents. I mean, we are seeing clients now that have pretty minor incidents, in my opinion. Then you have a flurry of these class action suits, which, they often have the save red lines from the last class action suit that they had before. So, how does the litigation and regulatory environment, impact cyber insurance? Like, how are you looking at that?
Yeah, I honestly think that's kind of a good way to segue to this next slide, and that we do see, you can see little blips in rates going up. And that's where we've kind of seen a lot of class actions happen, a lot of like even the wrongful collection stuff that I mentioned around pixel tracking, meta cookies. So we do see the actual rate environment react to some of those things that are going on from a litigation perspective. But that's where, again, we come in and we're advocating on the healthcare company's behalf to go in and say, all right, look, underwriting companies, We know you're scared because you got hit with all these claims all at once. We know you're freaked out about systemic losses because everyone's using this one third party to push their medical billing through, right? How do we as a insurance entity make sure that you guys aren't getting unduly penalized by your rates and getting coverage taken away from your policies because this litigation environment is really, bumping things up. So that's where a lot of our claims and attorneys folks on the carrier side go in and say, okay, this is, all these law firms are coming in and dinging all these healthcare companies for tracking on their websites. We've got to lower the severity and kind of call out, kind of legal trolls, so to speak, where they're all just like trying to make a buck off of each healthcare entity. So we have seen them driven down within those claims negotiations quite a bit. So we're seeing, especially in that wrongful collection space, those were coming in at like $500K to $1 million, and now we're seeing those driven down to $250K. So we are seeing affirmative coverage being given back to the clients.
Interesting.
And here we just see, I just wanted to show a percentage of the clients that we have at Marsh are still seeing, like, we saw a really steady decrease because rates just shot up after the COVID era. So many healthcare companies were getting hit with ransomware and a lot of other phishing schemes. And then we see it kind of dip down. We're seeing just a little bit of an uptick again because of the rise and some of the trends that Troy mentioned earlier, but not too much. So it's still, we see a lot of our larger healthcare entities still trying to take advantage of the rate environment now and bumping up limits when it's more affordable. And this, I'll just really quickly hit on. I already mentioned the corrective action coverage. Contingent BIPD. So this is bodily injury, property damage due to a cyber privacy event, right? So this is where we do see some activity here, right? Where folks are unable to provide care. Could it result in bodily injury? This is where if you have a package policy, a GL policy, right? Like folks might think that bodily injuries should be covered on there. A lot of those policies actually have exclusions for cyber-related incidents, breach-related incidents, because those policies want the cyber to find a way to underwrite to it. So I would encourage you to try to fight for this on your cyber insurance program. And then for broad social engineering, make sure there's invoice manipulation on there. We see this a lot, especially in the pharmaceutical, nutraceutical space, right? Where there's hefty checks going out to providers, to your supply chain vendors, and we need to make sure that that trigger is covered, that there is for a broad range of cybercrime. Business interruption, this is where your systems are shut down, you're unable, things like the Change Healthcare breach, right? Contingent business interruption is something that should be covered broadly under all policies. It's not one size fits all. It's not on all policies. So really important to make sure that if you heavily depend on any sort of provider in your systems to conduct, your healthcare services, you've got to have something broad on there to make sure that, the cyber insurance policy is going to subrogate on your behalf. Like you're not the one 100 providers in line going after this vendor that went down and shut down your operations for a couple of days. The cyber insurance policy is going to do that for you. And then of course, wrongful collection, which I already hit on.
Yeah, those are they're almost like gotchas. Why aren't these on all policies? How do you ensure they're on here? Practically to make sure they're there. Do each of these, I'm assuming, cost maybe more money? How does that work?
Sometimes there's a little bit of an additional premium, but usually it just comes with like a few additional questions, like the wrongful collections, for example. You're just going to get another like 5 questions from the underwriter that says like, hey, do you have tracking on your website? If you do, are you providing the appropriate disclosures to folks who are coming to your website, that sort of thing. And then, yeah, for business interruption, there shouldn't be any additional questions. And frankly, if an underwriter or broker is telling you that they're going to charge more money for that, you should fight against it. And sometimes the contingent bodily injury can come at a little extra cost, but based on your risk profile, it's probably worth it.
And this is really helpful. I think this slide is very important to just keep in mind when you're going through most likely a renewal process. Make sure you got all these things covered and what additional costs they would be. So, this is the ultimate question we always get asked about with regard to insurance. But really, what is the best way for healthcare organizations to analyze how much cyber insurance limit they should buy, and how much to budget for IT upgrades? That's the that's the main question we get all the time.
Yeah, there's always this sweet spot, this like inflection point, right, between how much am I spending on my risk transfer specifically, and then how much am I actually putting back into my IT budget to make sure I'm bolstering my controls. And it's a very unique little formula for everyone. Everyone's risk appetite is different. Everyone's budget is a little different. So what I would encourage any healthcare organization to do is to try to reach out to someone, whether it be a vendor, whether it be an insurance brokers, all do it, where you go in, you use those vulnerability assessments and those underwriting questions to actually create a projected threat model. So these are really helpful because it combs through years of claims activity and then also all the threat intelligence partners that are out there to say, okay, and it's usually what's called a Monte Carlo simulation. My 1 in 10, 1 in 20, 1 in 50 scenario, right, for ransomware, for business interruption, or for a privacy breach cost is going to be potentially $1 million, potentially $5 million, right? So it kind of goes through that based on your annual revenue, based on your services, and then also based on where your control environment is. Are you lacking controls? Do you have MFA in place? And it's going to say you're more or less likely to have this financial cost associated with this risk. So it's a really helpful exercise. A lot of companies offer it. A lot of brokers offer it. So really the best way to understand if your money is going in the appropriate direction, and if you are, overspending, underspending on your cyber limits.
Makes sense. If I were going to get one insider tip about how to get the optimal rates and coverage, and all, this is a complicated process, like what would be the one thing that you would recommend?
Best position for optimal rates. Okay, so we're about to get into that with Troy, so I don't want to steal his thunder, but it's all the best practices that we're about to go through. So there's, 12 security controls that we typically recommend. The top ones are still MFA. It's still MFA, secure backups, privileged access management tools. And again, we harped on this before. I know AI is a sticky subject, but if you can deploy AI driven security mechanisms, it's a huge advantage. So those would be some of my key takeaways. And I would also say, make sure you've got a solid person with you from whether it's your CISO, your risk manager, your general counsel, when you're answering underwriting questions, because you can always they shouldn't all be binary. It's like, maybe it's yes and, or maybe it's no and, maybe I don't have this control, but this is why, and this is what I'm doing instead. So to paint yourself in the best light, really make sure you have some consultation there and you're not going in blindly and just like, I think this is the right answer, right?
I second that. I mean, I whatever position you're in, I also would definitely involve legal, because I think a lot of times people don't understand, how IT is answering, a lot of these questions, which could also have effects later on. But thank you, that was incredibly helpful. Now I know you're going to go over some of the specific first party and third party coverage.
Yeah, I'm going to breeze through this so we have plenty of time for the rest of the slides, but just very quickly, right? First party is what we typically see most frequently. It can actually be the bulk of the cost a lot of time when there isn't a class action, right? So this is where you're getting paid directly. So The beauty about cyber insurance is that it's almost always pay on behalf of when it comes to first party costs. So that's where it's like coming out of your pocket, right? So we don't ever want our insureds to be in a position where they're having to pay out of their pocket in order to pay the legal fees, to pay the credit monitoring, to get a data restoration company in to make sure that, you know, they haven't lost critical patient information. So all of those things are paid directly by the cyber insurance policy. So the client is never dipping into their own pocket. That's what first party means, essentially. And this is where ransom is negotiated, right? There's a lot of misconception around like, ransomware is not really covered. No, 98% of the time or more, the cyber insurance policy is going to pay for those ransom negotiations and the ransom demands. They will pay the demands. There's, you know, an ethical dilemma there, but if a healthcare company, their backups have been compromised or their data has been exfiltrated on the dark web, that ransom can be paid by the policy. Almost never do we see it an actual like OFAC national, you know, cyber criminal risk there. And then you've got your business income. So that's what we talked about. I did see a question in the chat too around cyber insurance cover business interruption if it's the cause of the shutdown. I'm guessing you're asking if, you know, if a cyber incident is the cause of the shutdown. Yes. It also covers human error. So think about, you know, the CrowdStrike Microsoft incident where it was actually a system update issue. It wasn't even a direct breach. Those things are also covered, right? That's, you know, an unintentional system error. Those are all part of the cyber policy response. And I think most importantly, data restoration, we see this like clinical trial companies. Think about if their systems go down and they miss like millions of dollars worth of clinical trial data. That's something that can also be covered by the policy where they can go in and say, okay, cool, you got the money you need. Third party, so this is going to be, these are going to be your class actions. This is going to be your defense. This is where the fines and penalties come in. This is where HIPAA comes in. So if you have PHI fines and penalties right there in the privacy regulatory defense piece, again, you're going to get the cover of the investigation, the defense, even so privacy and network are listed out separately, but a lot of times the definition of privacy violation is very broad to cover a lot of those things that Jen mentioned earlier, right? GDPR, CCPA, all of the state privacy laws, et cetera. And I already covered this too briefly, but again, right, cyber vendors are who we work with on a daily basis. It's part of your insurance policy. Remember that. It's not just a risk transfer. Ensure you understand who those panel vendors are and that it's there to make sure it speeds up your timeline, right? And I would encourage everyone to not think that notifying your insurer is going to immediately mean you have an increase in premium. We see in fact, it's encouraged, you know, when we're looking from an underwriting perspective, if a client is, you know, has a clean claims report and they've never reported anything, it's almost more of a red flag. Whereas when you're in a position where you're like, I'm going to report this, air of caution, I'm going to make sure I have the appropriate people involved to make sure this isn't something that I have to report to OCR, right? It's really there as a tool for you. And typically post remediation after claims, we see clients in even better positions, right? Because they've improved their controls.
Yeah, very interesting, especially in the healthcare industry. I mean, data breaches happen, you know, on lower scales, you know, all the time. So that's really an interesting point. We're turning back over now to Troy to talk about some top cybersecurity controls. But, you know, what are some of the critical steps you suggest healthcare sector entities take now, really right now, to reduce their cybersecurity risk?
Yeah, so this kind of tailors back into this list here. And I'm going to start kind of going off the board, and I'm not going to go through all of these because we don't have the time. But the main thing, the first thing that an organization needs to do is know what you need to protect. So a lot of times missing assets. So you need to know all of your assets that are physical, virtual, cloud. They need to be known. And so often now, it's easy for personnel to have systems that IT, information security, don't know about and that they're using. And so if they don't know about it, they can't protect it. And so having that process to identify all of your systems is a critical first step in the process. And then implementing these controls. So you heard Hannah mention the 12 areas. These are the 12, and starting off just with a good authentication identification process, or having really strong authentication processes, and using multi-factor authentication. That's a first step, and especially with so many breaches occurring due to credentials being compromised. So having that extra layer that an attacker needs to go through is a great way to do that. And then we also mentioned kind of the logging and monitoring solutions. So those are the solutions that help you identify what's going on the network. So really having those processes in place is just another critical portion of that. And what we wanted to do is kind of show all of these processes really take time. And so the kind of this defense in depth zero trust process uses these basically administrative, technical, physical types of controls and safeguards to really protect this data. And so it takes multiple controls, multiple things that organizations really need to put into place in order to make this all work. And so I think that's the important piece here for this area.
Now we're going to move on to finish with cyber incident response, which is very important. So a quick polling question. Do you have a tested cyber incident response plan in place? Yes, but you haven't tested it? This would be no or unsure. While we're calculating this, I would say everybody should have one. A lot of the work that we're doing now is we're re-looking at it and aligning it to your general crisis response process so that everybody kind of follows the same process, at least as it elevates up, and making sure that it's not too detailed, because in the event of an emergency breach, sometimes it's not always followed. And then always practice it. There are a lot of people respond. Wonderful. So yes, there's good yeses. Testing it, definitely should test it. No seems the lower amount, and unsure. So for those unsures, go back and ask, can I be part of practicing that? Because really, it takes the village there. So Hannah, I know you're going to go over this, and while you go over it, can you just quickly mention how much money also is saved by doing this at the same time? I think would be very interesting.
Do you see there's...
You're back.
Can you hear me?
Yeah, you're back.
Yeah. Okay, so we do see, based on some studies by IBM, Verizon, cost of a data breach, we do see that healthcare organizations that have a tested incident response plan in place experience an average cost savings of $2 million in these. So based on, Troy's previous statistics, I can't remember what you said, Troy. I think it's like over 4 million on average. So you want to cut that in half, essentially. It's really important to have this in place. And I think it also coincides with some of the questions we've seen in the chat that I'm trying to diligently answer while I'm on mute here. But yeah, when we get through the meat of it in the next couple of slides, I think it'll make more sense.
Turning it back to Troy.
Yeah, the most important part is to really understand the process. So thinking about those individuals that are unsure about their incident response or if it's been tested, it really is important to know if you are a part of an incident response team, and this is not just IT information security, this is a lot of different teams that need to be involved. There's going to be legal, HR, senior management, you name it, they need to know what their role is. And so really, once you've potentially identified an incident, then really going through and executing the plan. So having that plan, having it documented, knowing what it actually says is critical. We do a lot of tabletop exercises and other types of testing with our clients. And so when you do that, you see these areas where things aren't known or what you need to do. So what is the next step? Thinking about if it's a ransomware attack, are we paying for this? Can we? And what are we doing? So we really need to have this process down, really going through it and identifying all these different aspects within the whole response process, so that we can, one, quickly get through this process and then start figuring out, well, what happened, and then how do we fix it? How do we remediate? What are we going to do? Because now we're on other steps, and what are we doing? So having a plan, critical, knowing all the steps, and having all the individuals that are part of that role in making decisions or doing different things, that's going to be a critical portion of this, and constantly updating the response plan.
Thanks, Troy. So now, after we've stressed all of you out about this, and it is a very stressful space, and for those of us that work in it, it is as well, but just wanted to poll you about how worried are you about your cybersecurity controls or your incident response and recover capabilities? This will be our last polling question of the day. Thank you so much for participating in that. After we get this answer, we're going to kind of round the room. Maybe if you want to start, Troy, and then Hannah, about, key takeaways. Looks like we have a good amount of attendees responding here. And really the key here is it is a very stressful space, right? Just in the last few minutes here is you're dealing with oftentimes threat actors in other countries trying to extort money for you. So the best thing you can do to calm your nerves is to practice and prepare. So very worried. That's actually good. It's down from what we've seen before to 13%. A lot of people more prepared. Somewhat worried. That seems, 60%. Not worried at all. I would be worried. Every organization has 1,000 holes, and the threat actors are always one step ahead. But if you have a great incident response plan, then you should be in good shape. And not sure it's my responsibility. I think it's everybody's, responsibility. So thank you so much asking that. And our last minute or so, maybe we're not going to read these, but Troy and Hannah, maybe some key takeaways.
Yeah, so my takeaway is oftentimes we see that IT, information security, is responsible for cybersecurity in general, and that's really not the case. They can't be. They really need a culture of cybersecurity, and that means involving the whole organization. That is key, because the attackers are not going to go away. And as Jen just mentioned, they're finding these vulnerabilities they're going to exploit them. So we as a organization need to make sure that we've got processes in place to always be looking through this. And I know we're out of time, could talk about more, but I give everybody else.
Thank you. We'll try to answer. Just Hannah, if you finish up, I just want to just turn the slide really quick while you're talking, just for those people that have to go, so that they have the CLE code, which is X, D is in dog, P is in piano, 5-3. And Hannah, maybe you could just close us out.
Yep, there's some great questions in the chat. So I think a couple of the things that are takeaways for that are make sure your risk manager, someone from your C-suite, and whoever is responsible for IT security is in the room when you're making IT budgeting and risk management decisions around the insurance policy. And again, we harped on it before, incident response planning, that is key. So, thank you so much for the webinar. Thank you all for being here. Thank you for the phenomenal questions. And I'll leave it at that.
Thank you. Just an excellent session. Thank you guys so much for presenting. This was just wonderful. And I will turn it back to you now, Amy.
All right. Well, thank you, Jennifer and Troy and Hannah, for a great presentation today. Also to our audience, thank you for submitting your questions. If you have additional ones, please don't hesitate to reach out. And then if you met all CPE requirements, your certificate is available to download now in the CPE progress window. A copy will be emailed within 2 weeks as well. And then if you're needing CLE credits, please don't forget to fill out the attorney affirmation form that's linked in your console with the 5-digit code that Jennifer announced. And then also, I'm delighted to announce that registration is now open for our annual Executive Healthcare Conference. Both Marsh, McLennan, and Foley and Lardner are sponsors of our conference and will be in attendance. So we all hope to see you there. And then finally, here's a link to a survey for today's presentation. Your feedback is always appreciated, and thank you for joining us. Take care, everyone.
Thank you.
Thank you again.
Thank you.